Yeah, there's two that I can think of right off the bat. One of them I've already mentioned, which is this notion of patient-centered care.
Right.
And where you don't need to be an MD or a PhD to be able to gain control and access to your care. Now, if you have a chronic care condition, that's going to be really important. Many people aren't paying attention to that right now, either because they don't have to, or in some cases because they think that they can't.
Right.
So you're seeing really a cultural shift. This is not about technology or operations. This is about making people aware that they can gain access to their records, that they can keep track of themselves, and because they're going to be the beneficiaries, right? You can talk about societal costs, you can talk about new drugs and medicines, the big data, genomic problems. All these things are phenomenally interesting. But the most important thing is I want to know. I want to know my kids' immunization records. I want to know the treatments that my wife is receiving. The other huge opportunity, and I hope we'll get a chance to touch on this in the discussion, is changing these stovepipes where you have these proprietary closed systems completely isolated from one another, where either the government or in some cases the large national systems are paying through the nose to try to get just sort of a thready connection between them.
Right.
What we're trying to do now, and at the VA we've done it, we're opening up these systems, we're creating standards, we're creating modules so you can plug, replace things. You don't like your scheduling package, we can fix it. You don't like your pharmacy package, we can fix it. Not in 5 years or for $500 million, but this afternoon for cheap, right? So moving from this doctor-centered model to a patient-centered model, from a closed system to an open system, is enormous opportunities. And there's enormous economic opportunities for everybody at the table and those listening, but the real beneficiaries are going to be the patients, and that's what's most exciting to me.
Yeah, terrific.